You're feeling a little off. Something's changed in your body, but you tell yourself it's just stress, your diet, or getting older. What you're about to see could save your life. Colon cancer doesn't announce itself with dramatic pain at first. It whispers through subtle changes that are dangerously easy to ignore. By the time the symptoms become unmistakable, the cancer may have already advanced. Today, we're breaking down the 10 early warning signs of colon cancer that demand your attention, especially if you're over 45. Why this cancer is different. Colon cancer is now the third most common cancer globally, with a disturbing rise in cases among adults under 50. What makes it particularly dangerous is how easily its early symptoms can be mistaken for common conditions like IBS, hemorrhoids, or everyday stress. This is the critical point. When detected early, the 5-year survival rate is over 90%. But when it spreads to distant organs, that survival rate plummets below 15%. Those subtle signs are your body's only way of sending an early alarm. 10 early warning signs of colon cancer. Before we dive into these life-saving signs, I want to share something important with you. Did you know that 99% of our viewers watch without subscribing? If you find this information valuable and want to help us reach more people with critical health knowledge, please support our channel by subscribing and liking this video. Your support makes all the difference. Now, let's begin with the first crucial symptom. 1. The change in your body's rhythm that won't go away. This isn't about occasional digestive issues we all experience. This is a fundamental shift in your body's natural rhythm that persists for weeks. You might notice your bowel habits have completely changed. What was once regular becomes unpredictable. Some days bring persistent diarrhea that doesn't respond to typical remedies, while other days bring unexplained constipation. Many people describe a particularly frustrating sensation of incomplete evacuation, where you feel like you still need to go immediately after you've just been to the bathroom. This pattern represents a significant departure from your normal digestive function. 2. When your stool tells a visual story. The appearance of your stool can provide crucial clues about what's happening inside your colon. One of the most telling signs is when stools become consistently narrow, thin, or ribbon-like. This change in shape often occurs because a growing mass within the colon partially obstructs the passageway, literally reshaping your stool as it moves through. Think of it like toothpaste coming out of a tube when something is pressing against it. The shape changes to navigate around the obstruction. This sign is particularly significant because it's not something that comes and goes, but rather represents a new persistent pattern. 3. The blood that demands attention. Perhaps the most alarming sign, blood in your stool should never be ignored or automatically attributed to hemorrhoids. Bright red blood might indicate bleeding in the lower colon or rectal area, while dark, black, tarry stools, medically known as melena, often suggest bleeding higher up in the digestive tract. The darkness occurs because the blood has been digested as it moves through your system. While hemorrhoids are common, assuming that's the cause, without proper medical evaluation could mean missing something more serious. Any bleeding warrants a professional assessment. 4. The mysterious weight loss. When you lose significant weight without changing your diet or exercise habits, your body is telling you something important. We're not talking about fluctuating a few pounds, but rather losing 10 pounds or more over 1 to 2 months without effort. This occurs because cancer cells can alter your metabolism, consuming your body's energy stores and potentially releasing substances that change how your body processes nutrients. This unintentional weight loss often accompanies decreased appetite and a general feeling of malaise. 5. The abdominal discomfort that becomes your new normal. While occasional gas or bloating is normal, persistent abdominal discomfort represents something different. This might feel like ongoing cramping, gas pains that don't resolve, or a general sense of abdominal fullness and discomfort. What makes this significant is its persistence. It's not something that comes and goes with particular foods or stress, but rather becomes a constant presence in your daily life. Many people describe it as a feeling that something just isn't right in their abdomen. 6. The exhaustion that sleep can't cure. This type of fatigue is different from ordinary tiredness. It's a deep, pervasive exhaustion that doesn't improve with rest. You might wake up feeling as tired as when you went to bed, or find that simple daily tasks suddenly require tremendous effort. This often relates to anemia caused by slow, chronic bleeding from a tumor that you might not even notice in your stool. As your red blood cell count drops, your body's ability to transport oxygen diminishes, leaving you feeling constantly drained and weak. 7. The urgency that doesn't make sense. That persistent nagging feeling that you need to have a bowel movement, even when you know you don't, is medically known as tenesmus. This sensation occurs because a mass in the rectum or lower colon creates pressure and sends false signals to your brain that your rectum needs emptying. It's particularly frustrating because no matter how many times you visit the bathroom, the feeling doesn't resolve. This symptom is especially common with tumors located in the rectal area. 8. The nausea that has no clear cause. When colon cancer causes partial blockage in the bowel, digestive contents can back up, leading to persistent nausea and sometimes vomiting. This isn't the temporary nausea that comes with a stomach virus, but rather a lingering feeling of queasiness that may worsen after meals. When combined with abdominal pain and changes in bowel habits, it suggests the digestive system is experiencing significant disruption that needs investigation. 9. The silent sign in your blood test results. Sometimes the first indication of colon cancer appears not in how you feel, but in routine blood work. A low red blood cell count, anemia, detected during a physical exam might be the initial clue to slow, chronic bleeding in the colon. This hidden bleeding can occur over months before you notice any visible signs in your stool or experience symptoms like fatigue. This is why routine blood tests can be so valuable in early detection. 10. The family history that changes your risk profile. Your genetic background plays a crucial role in colon cancer risk. If you have a first-degree relative, parent, sibling, or child who developed colon cancer or advanced polyps before age 60, your risk significantly increases. This doesn't mean you will definitely develop cancer, but it does mean you need to be more vigilant about screening and aware of subtle symptoms. This family history should prompt an open conversation with your doctor about when to begin screening and how often to repeat it. Your action plan. What to do next. If you recognize any of these signs, especially in combination, here's your immediate action plan. 1. Schedule a screening, either a colonoscopy or at least a FIT, fecal immunochemical test. 2. Request a complete blood count and iron panel if you're experiencing fatigue. 3. Document your symptoms, their frequency, duration, and any patterns for. Discuss your family history openly with your healthcare provider. Remember, early-stage colon cancer typically causes no pain. Waiting for pain to appear means waiting too long. Prevention. Your first line of defense. The most powerful step you can take is prevention. Most colon cancers begin as benign polyps that can be safely removed during a colonoscopy, making this one of the most preventable cancers. Your prevention strategy. Increase fiber intake from vegetables, legumes, and seeds. Eliminate or reduce processed meats and excessive alcohol. Maintain regular physical activity. Even 30 minutes daily makes a difference. Begin screening at 45 or earlier if you have risk factors. Don't let fear or embarrassment prevent you from taking action. This is about giving yourself the best possible chance for a long, healthy life. Your body sends signals for a reason. Those subtle changes we often dismiss could be the most important messages you'll ever receive. Has this video made you think about changes you've noticed in yourself or someone you care about? Your experience could help others recognize their own warning signs. Please share your thoughts in the comments below. Your story might give someone else the courage to act. If you believe in empowering people with potentially life-saving information, join our community by subscribing for more essential health guidance every week.